Hi, everyone, and welcome to our final session in the Live Well, Sleep Well, Live Well series, our free online educational series that we've been running since the expo. Because just because the expo isn't running, that doesn't mean that we can stop supporting our sleep. So I'm super excited to have on this last episode Dr. Karina Patel and Sarah Beach, who were at Resteasy Expo as our speakers and also vendors. And they have had such great feedback from their talk at the expo that I just wanted to get them on so that they can dive a little bit deeper tonight. And if you've got any questions, should be able to email them through and maybe we can get them to answer. Or if you're on live, feel free to ask some questions and we can get some answers for you. So I'm going to hand straight over because I think we're going to need all the possible time to go through all this juicy content. So first of all, thank you so much for joining us tonight. It's great to have you here.
Thanks so much, Holly, for inviting us along. We're very happy to be here, and it was a great event you had at the expo recently. Looking forward to doing some more next year. I see you're going to be doing some like more smaller ones across the year, so that'll be really
Yeah.
exciting.
Reach more
So,
people.
yes. So tonight we are going to our presentation is Transform Your Sleep with help from Sleep Well Australia. So we're going to be discussing the signs and symptoms of sleep breathing disorders for children and adults. So first of all, just a brief introduction. My name's Sarah Beach, and this is Dr. Karina Patel. We are the founders of Sleep Well Australia New Zealand, and together we bring over 45 years of clinical experience in healthcare. And over the past 10 years, we've helped over 10,000 people manage their sleep problems. So Karina has owned and operated three prestigious sleep centres in London, Devon and Dubai. And I've also spent a significant part of my career in Switzerland and Singapore. So we've both seen firsthand the challenges and impact of poor sleep on overall health from a global perspective. It's not just Australians this affects, particularly with conditions like insomnia, snoring, and sleep apnea. And sleep apnea is also known as the world's biggest silent killer. So it's a pretty big tagline for sleep apnea. And despite these conditions being very common, many people are unaware of the seriousness of these conditions or even how to address sleep problems. It seems that once we go unconscious in the evening, and we wake up in the morning, nobody really cares. Even if they're having bad sleep, so they seem to wait until there's a problem. So at Sleepwell Australia, we offer a range of services to help evaluate and improve your sleep. So this includes our one-on-one personalized coaching. We do a bespoke 6-week sleep coaching program, and we deliver that internationally, as well as delivering customized workshops and seminars to businesses and to corporations. So we'll come back to those a little bit later. So I'll hand you over to Dr. Karina.
Okay, so sleep breathing disorders, you're probably thinking, what are they? So, in simple terms, sleep breathing disorders are sleep disorders that originate from a breathing problem. So, there's around 79 different sleep disorders, and today we'll just be talking about the sleep breathing disorders. Now, some common things are related to those, and we'll be going into those as well. So, I'll be focusing on adults today, and Sarah will be talking about children, as it's possible for everyone to have these, but the signs may be a bit different for an adult versus a child. There's approximately 1 in 5 Australians that are estimated to have a sleep disorder, so it's a pretty high number. So if we're going to get technical for just a second, I'm going to keep it really simple. But sleep isn't just a linear thing. It has an architecture. And to keep it easy, we're going to talk about 2 different categories. So the first category is non-REM sleep, and that's broadly speaking where your body heals and repairs. And then we have REM sleep, and that helps your brain repair. So it's broken up into these 2 stages or these 2 parts where it's your body and your brain. So non-REM can further be divided into 3 stages. So if you look at the little chart there, you've got stage 1 and stage 2 and 3. So that's where we transition from being in a light sleep to a deeper sleep to an even deeper sleep. And that's essential for your physical recovery and your optimal immune function. And during this stage, that's where your body is repairing its tissues. And then you've got your REM, which is also known as your dream sleep. So this stage is really important for your brain. So it consolidates all your memory, all your learning that's happened during the day. It helps regulate your mood. So REM, you're probably wondering where's the name come from. So it stands for rapid eye movement sleep, because the rest of your muscles are inactive, but your eye muscles are still going. So if you've ever noticed a pet or like you with Arlo, your dog perhaps, where their eyes are twitching and their legs are moving and it looks like they're having the best dream ever. So that is REM sleep. Now, these cycles, you're supposed to go through these cycles. They should last around 90 minutes. And a typical night, you should go through these cycles 4 to 6 times. And you have to go through all the stages of the cycle for it to be a good and effective level of sleep for your brain and your body. So tailoring your sleep routine to ensure that you move through these stages can significantly impact your physical as well as your mental well-being. Now, we have some understanding of those sleep cycles now, so we'll go back to sleep breathing disorders and some common signs and symptoms you may see with sleep breathing disorders. So you've got things like snoring, brain fog, irritability, insomnia, daytime sleepiness, tooth grinding, morning headaches, mouth breathing, and then some of the ones that people don't really sort of talk about as much, but it will generally bring up a little signal, especially in a male brain. If you mention things like erectile dysfunction, suddenly you're interested in getting your sleep sorted. So those things in particular are things that you need to look out for. Now, sleep apnea. So this is one of the most talked about sleep breathing disorders. And in simple terms, it's where you stop breathing when you sleep. So it has to happen at least 5 times an hour for you to be diagnosed with sleep apnea, but it can happen over 30 times an hour or more. So imagine you're being choked in excess of 5 times an hour, and then imagine how that's going to make you feel. The good thing about that is obviously you're unconscious, but the bad thing is it does have long-term effects. So this is why our bodies start failing to repair. So when they should be healing, there's a much like interrupted, constant barrage that happens to your organs. They're deprived of much needed oxygen, and it's associated with a whole bunch of different chronic diseases, as well as being linked to cognitive decline, mood disorders, immune dysfunction, and a whole bunch of other things that affect our quality of life and longevity. Now, snoring. So you're probably wondering if snoring is just one of those things that's just a bit annoying. It's the thing that chucks your bed partner out of your bed and all of that kind of stuff. But it is more than that. So it should never be considered as normal. So it happens when your airway is partially blocked, causing the tissues in your throat to vibrate and create a noise. So it isn't just annoying, it does have real life consequences. And one of the most serious risks is that those vibrations can loosen the plaques that are in your carotid artery, and they can track down into your heart, and it can actually cause a heart attack. So snoring should always be addressed. And I don't mean getting your husband or wife to sleep in the next room. I mean, a sleep test would be ideal to investigate this to see if there's something else going on. The next one is insomnia. So insomnia is essentially classified by a difficulty of falling asleep, staying asleep, and then consequently you end up waking up feeling unrefreshed. But the effects are far-reaching. So physically, it can increase the risk of chronic diseases like hypertension and diabetes. Mentally, it can contribute to depression, anxiety, reduced cognitive function, and then your daytime functioning suffers as well. So with fatigue, you have decreases in performance, leading to accidents and lower productivity at work even. So it significantly reduces that quality of life and well-being again. It doesn't just affect individuals, but it has a broader economic impact as well. Just in Australia, it has been shown to cost the economy roughly 66.3 billion Australian dollars in healthcare expenses and lost productivity. So it's massive. And it's managing the insomnia that kind of is something that needs to be talked about more. So good practices, sleep hygiene, which encompasses a whole broad range of things. Engaging in things like cognitive behavioral therapy, which is now starting to make moves in Australia. Certain lifestyle changes, but we're not talking about lifestyle changes that are too hard, because then you just won't do them. So really easy things that you can incorporate into your daily routines. And it's the interrupted sleep that matters, not necessarily the number of hours. So what we're looking at here is something that affects 1 to 3 Australian adults. So this is a really, really silly comment that I see up all the time, or just a generic thing. So most adults need or require 7 to 9 hours a night. But most adults, if they do get 7 to 9 hours, no one's talking about the quality. So it really doesn't matter if you're getting 9 hours of rubbish sleep. What you want to focus on is if you're getting a shorter amount of time than that, then that's fine if you have a good quality of sleep. So that's me and my little rant done. But I'm going to pass you over to Sarah now. She's going to talk about the kids.
Yeah, so when we look at the sleep needs of children, it's slightly different. So adults, they say the range is 7 to 9 hours, but like Dr. Karina said, you're looking at quality, not just the quantity. With kids, we need quantity and quality. And infants, they'll sleep for 14 to 17 hours a day. Toddlers, 11 to 14 hours per day. School-age children, 9 to 11 hours. And teenagers, pull it back a little bit again, 8 to 10 hours a day. So it's really important to be across the amount of sleep needs they do, because obviously as small people, they're growing and developing a lot and needing to consolidate all the learning that they do. So then we look at, I'm going to press play. I'm not sure if you're going to hear this, but if anyone thinks this looks familiar, then they really need to listen carefully to this next section. So what we can observe here is this child is mouth breathing. So the mouth is open, but if you look at the posture of that child with the chin up and the neck extended, you can see they're in that recovery position. They're really using that mouth as an emergency exit, trying to gasp for air. And you can see the eyes in that REM sleep sort of moving there. But if you could hear the audio, you would hear that this child is actually gasping, and there they finally take a breath. So that's what we see. It looks like sleep apnea in children. So they're not getting the amount of air they need to through that airway. And you'll also notice that their chest, it's a struggle for the rise and fall of the chest. So it really looks laborious. That is not a restful, peaceful sleeping child. So I would encourage you, if your child does sleep like this, take some video, because that's really helpful to take to the GP. And then we're going to look at referral pathways. But get your evidence first of all, because you can go to the doctor and say, my kid sleeps with a mouth open and struggles to breathe. That means nothing unless you've got some evidence, okay? So, and with kids, I mean, we know sleep is linked to immune function, but kids who don't get enough sleep are really more susceptible to illnesses. They're more susceptible to behavioral and cognitive issues. So the way it presents in kids, the impact of poor sleep is hyperactivity, inattention, irritability, mood swings. You'll see they have academic struggles, memory issues, and concentration problems, which again, as adults, we suffer from those types of issues, the memory issues. So that's the cognitive behavioral. The physical and emotional health effects are growth. A child who's not breathing well is not developing well, and you'll see they can have a smaller stature. They don't have the same growth as their peers. Again, the immune function, you'll see they're more susceptible to picking up every bug that exists. And opposite to the inability to grow, you can also get excessive weight gain because of the hormones that are produced when you don't get enough sleep. So they're in that fight or flight way. So emotional state is the word I was looking for. So emotional regulation difficulties. I mean, again, kids are trying to learn how to behave and how to act and how to interact. So, you know, not having sleep really does impact that ability to regulate themselves. So you will get more tantrums and a lot of social interaction challenges. So, and especially, you know, in this day and age where we do have a lot of diagnosis of neurodiversity, you really want to be especially watching those kids and helping them as much as you can with getting good quality sleep because they already have other challenges. So parents who are worried about their child snoring, definitely talk to your pediatrician if you've got one. I know it's not always easy to just get into a pediatrician, so definitely your GP and take some evidence with you. And although snoring, we say snoring's never normal, but sometimes in kids you can get a bit of intermittent snoring if they've got a cold or a flu, or, you know, so don't panic if your child has you know, a cold for a week and you hear some snoring, but that's the only time they ever snore. That's okay. It's when it's consistently more than a few nights a week, that's when you want to start to investigate it. And so the things that parents should look for are gasps or difficulty breathing while sleeping, as we saw, snoring 3 nights a week or more. Bedwetting can also be a sign of inadequate oxygenation, inadequate breathing. You might get a bluish tint to their skin, morning headaches, daytime sleepiness, the difficulty concentrating on learning, inattention, and what we've discussed before. So it's important to note that these factors can be indicators of sleep disordered breathing, but not all children who snore have these issues. Okay, so just get your doctor to start the investigations. So what can help reduce snoring in children? Well, like we said, if it's just infrequent snoring, it will go away on its own. But in many cases, we need to investigate. So the first step is you can also is not only talking to your doctor, but you can also talk to your dentist. The dentist has the ability to look in your child's mouth and to check their airway to see if they have those big juicy tonsils in the back of their mouth, to see if they're able to breathe through their nose, to see if they've got any signs of crooked teeth or high arched palates. There's lots of signs and symptoms that dental practitioners can have a look at. Also, asthma and allergies can contribute to snoring, so that's something to consider. So doctors might recommend additional testing for those allergies and treating those. When it comes to surgery, so like I said, if they've got those big juicy tonsils, sometimes they might have overgrown adenoid tissue. So that would be something that the GP would refer you to the ENT, and they would have a look at clearing that airway so there's less blockages to contribute to that snoring or that sleep apnea. And then again, sleep hygiene with kids. It relates to adults and kids. We've got to look at their environment, look at their habits, setting a consistent bedtime schedule, making sure the room is nice and dark, and reducing the light as it's getting close to bedtime. Obviously reducing screen time. I think everyone knows about that now. But just setting up the room to be as quiet and as comfortable as possible. And while these steps for snoring in children are more like home remedies than medical treatments, they are beneficial. So if you do have poor sleep hygiene as a child, you will exacerbate the risk of fragmented sleep and the corresponding problems related to behavior, thinking, and health.
Okay, so just back to me now. So the impact of poor sleep on your health and lifespan. So just a bit of a summary or a recap here, but poor sleep, as we've said, significantly impacts your health and can even shorten your lifespan. And plenty of research backs this up. So here's how not getting enough sleep can affect you. So you've got your higher risk of serious illnesses. So studies show that not sleeping enough can increase your chances of developing heart disease, diabetes, and obesity. For example, there's been research published by the European Heart Journal that found that people who sleep less have a much higher risk of heart problems. You've then got your memory and thinking problems. So poor sleep can make it hard to think clearly, make decisions, solve problems, and it can even lead to an increased or a higher risk of developing Alzheimer's later in life. Then you have your mental health struggles. So there's a very strong connection between sleep problems and mental health issues, such as depression and anxiety. The weaker immune system we've talked about before, so not getting enough sleep weakens that immune system, making you more susceptible to infections. Studies show that it can actually lower your effectiveness, the effectiveness of your T cells, which are a critical part of your immune defense system. And then a shorter lifespan. So you can actually reduce your lifespan by up to 10 to 15 years, which is obviously a significant portion of your life. So a final thought would be that given the solid evidence that there is linking insufficient sleep with numerous negative outcomes, it's very clear that managing your sleep isn't just about avoiding health problems. It's actually crucial for a longer and happier life. So taking steps to get your sleep tested and treated if necessary is pretty much essential, and it can make a big difference to your overall life. Now, it's not all doom and gloom. We have some solutions. We have a few things, as Sarah mentioned at the start. One of them, which is something that you can do in your own time by yourself, if you like, is an online 6 weeks to better sleep coaching program. So what we've included in that are weekly videos that you get at the start of each week. It's a rundown of what to expect that week, and it comes with a workbook, but essentially you're spending that whole week on this one easy task to implement. And we don't want you moving on until you've got to that second week where we'll introduce something else. And it's one of those things where not one size fits all. So it's not going to be that every single tip that we give you is going to work for you. But that's the reason why we've given you little bits that you can work on. And then when you find the thing that works for you, you run with it. And it's something you've got lifetime access to. So if you find that in, a couple of years' time, you're wanting to go back and see if there's anything else you can do to improve things further, then you can go ahead and do that as well. Some people choose alongside the 6-week program to have a little bit of hand-holding by us, which is totally fine as well, because we can give you even more tips. But that involves the one-to-one consultations. So we do consult like 45-minute consultations where we'll go through everything, what you're experiencing, what the history has been, and then give you tailor-made sleep strategies for your personalized sleep. And then, like Sarah said as well, the sleep coaching workshops for corporate groups. So if you have a company and you're wanting to do a little bit of a different style, like wellness workshop, we do offer that as well. And I know sleep is generally boring, but we try and make it fun. So yeah, that's the 6 weeks to better sleep coaching program. So we've extended the 50% off of that for the Rest Easy followers. And then I just wanted to see if this would play, but it's just someone that you might be familiar with. She's a breakfast radio host, but the reason I wanted to show you her testimonial from working with us is because on the face of it, she just seems really happy and bubbly all the time and full of energy, and you would have never known that she had any sleep problems. But I'll let her explain in her own words if this plays.
Hey guys, it's Robin Bailey here, and I'm a breakfast radio announcer. I am also someone who suffered from sleep apnea. It was awful. I just would wake up multiple times during the night, and I just accepted it as part of my life. I thought that was just something that I was going to have to live with. But I went and saw the Sleepwell team, and they legitimately changed everything about how I slept, how I woke up in the morning, and how I felt about myself because I was no longer struggling to have a good night's sleep. I cannot recommend these people enough. They are literally life-changing. So have a chat to the Sleep Well team, and seriously, it might totally change your world.
And Robin is a great advocate. We get lots and lots of clients from Robin recommending us because it has helped her so much. Okay. And yeah, so when we're looking at who does sleep affect, we always think of the person who's snoring or the person who has the tiredness or the issues, but we also need to consider those around them. And I'm not sure if you can hear the audio in this, but Dad is snoring his head off, and the baby is just going, come on, Dad, living a nightmare. So, here's this little individual who's meant to be getting, their 11 to 14 hours of sleep a night, and even their little sleep is interrupted. So if you can't do it for yourself, when people tell you snore or you've got sleep apnea, if you don't go and get tested for yourself, do it for those around you, because it does interrupt their sleep cycles as well, and it does have an impact on them. And unfortunately, we see a lot of female clients who suffer from pain conditions, and quite often, they may or may not have a sleep disorder, but their husband, is sleeping like a freight train beside them. So we're constantly having these conversations about getting both people tested, because there's no point in you being, having no issues, but we're ignoring what else is going on in the room. So it's really important to address that for your loved ones, if not for yourself. So we just want to thank you all for joining us tonight, and we just want to leave you with this final note. Times have changed. It's no longer necessary to live with your sleep problems and think that's as good as life gets. So we want you to let us help you sleep well and live well. So any questions? We've got our contact details here. So feel free to email us, have a look at our sleepwellcoach.org website. You can go on there, you can book a sleep study directly without having to see a GP. You can just go on there and book a sleep study. You can book a consultation with us, whether that's to talk about yourself, your partner, your kids. If you don't know where to start, if you just need to be handheld through this whole process, or if you've got a sleep study done and then you didn't really know what to do next, that's all the stuff we can help you with. We can guide you through all those processes. So feel free to reach out. Thank you, Holly.
Thank you so much, guys. That was awesome. There was so much information in there that will help get people thinking. And yes, reach out to Dr. Karina Patel and Sarah Beach for any of your questions. We do have one here from Les that you did sort of touch on, but I'll just read it out in case you can go a little bit deeper. Just says that my daughter moans in her sleep as she's breathing. Not really a full snore, but could this be an indicator? It's as she's breathing out.
How old is she?
She's 8.
8.
Yeah, she's 8 years old.
Yeah. I think any noisy breathing is worth investigating. Okay. So if you see, what peaceful sleep looks like, and any sort of noise is that airway constricting. So it's worth investigating. Is that what you?
Yeah.
Yeah.
There's no harm in looking into it. And if it's nothing, then great. And if it's something, then you caught it early.
Yeah. And so again, a trained eye will be able to look at her and listen to that audio and tell you whether or not you need to go further with that, or if that's really benign, and don't worry. Like I said, there's lots of oral indicators as well. If she's got really crooked teeth, if she's mouth breathing, if she's having headaches, if her jaws don't match up, there's a whole heap of things that give us information to be able to help guide you on whether or not you need to get that looked at. Because sometimes treating the sleep is treating, their jaws, getting orthodontics done. So yeah.
Oh, thank you very much.
You're welcome.
It's all good.
Amazing. Thank you so much again once for your time. It has been a pleasure to have you involved in not only the expo, but coming on the podcast and now doing this. I love listening to all the stuff that you've got to share. And each time that you've spoken, I've picked up on something different and gone, ah, right. So it's always good to re-listen to these things over again.
Yes. Yes. And as you, the whole reason you kind of, or what I understand to be one of the reasons you started this whole journey, Holly, is because you noticed how much massage and touch impacts sleep. So, you know, that's something that we are big advocates of, as well as part of rehabilitating people with insomnia, because, you know, there's a lot of stress out there. And so we're very much supporters of getting some relaxation, massage and movement and all of those things. We cover all of that in the program. So we're really happy to be connected to a network of practitioners who can support that.
And how great is it now that this is being talked about?
Yeah.
Yeah.
Yeah, exactly. It's not all in isolation and everyone's trying to be one-trick ponies. We're all now working together and getting better outcomes. Go figure.
Yes. Teamwork makes the dream work, hey?
Yeah, I know.
Well, thank you, everybody.
Okay. Good night.
Thank
Good
you.
Good night,
night.
Liz.
Bye.
Nice to see you both.